Have you noticed that headaches seem different after 60? Not just in how often they appear, but in how deeply they affect you. They're no longer a simple annoyance you can brush off and move on from. They linger in the background of your day, drain your energy, interrupt your sleep, and sometimes arrive without any clear reason at all, even when you haven't done anything wrong. What's surprising and rarely explained is that many headaches in seniors are not actually caused by stress, screen time, or aging itself. Instead, they're often triggered by silent nutritional deficiencies that develop slowly and quietly. Deficiencies most older adults have without realizing it. In this video, I'm going to show you exactly which nutritional gaps are most likely to be triggering headaches and migraines after 60, how to recognize the signs your body is giving you, and what you can safely do about them. Stay with me because one of these deficiencies affects more than 40% of adults over 60, and correcting it can dramatically change how your head feels in just a matter of weeks. Hello, I'm Dr. Nereta, and welcome back to the channel dedicated to helping adults over 60 understand their health without fear, confusion, or unnecessary medication. If you've been told your headaches are just stress, just dehydration, or just part of getting older, I want you to know something right away. Aging itself does not cause chronic headaches. What aging does do is change how your body absorbs nutrients, how it responds to inflammation, and how resilient your nervous system is under stress. Those changes create vulnerabilities, and nutritional deficiencies are often the trigger that turns those vulnerabilities into pain. This video is educational, not diagnostic. And if you ever experience sudden or severe headaches, vision changes, confusion, or weakness, you should seek medical care immediately. But for ongoing, recurring headaches that seem to have no clear explanation, this conversation matters. After the age of 60, the body undergoes a subtle but powerful shift. Stomach acid production declines, digestive enzymes become less efficient, and the intestines absorb fewer vitamins and minerals, even if your diet hasn't changed. At the same time, many common medications prescribed to seniors, including blood pressure drugs, acid reducers, diuretics, and cholesterol medications, quietly deplete nutrients your brain depends on. The result is not immediate, it doesn't happen overnight. Instead, it builds slowly until one day your head starts aching more often, your migraines last longer, or the pressure behind your eyes becomes part of daily life. These headaches aren't random, they're signals. One of the most common and most overlooked deficiencies in seniors with headaches is magnesium. Magnesium plays a critical role in relaxing blood vessels, calming overactive nerves, regulating neurotransmitters like serotonin, and preventing muscle tension in the head, neck, and shoulders. When magnesium levels drop, blood vessels constrict more easily, nerves fire more aggressively, and muscles remain tight instead of relaxed. Many seniors describe magnesium related headaches as a tight band around the head or a deep pressure that won't fully release. What makes magnesium deficiency especially problematic is how common it is. Aging reduces absorption, stress increases loss, and medications like diuretics flush magnesium out of the body faster than it can be replaced. Even seniors who eat relatively well can become deficient without realizing it. Over time, the brain becomes more sensitive to light, sound, and changes in sleep, setting the stage for migraines that seem to come out of nowhere. Another major contributor to headaches after 60 is vitamin B12 deficiency. Vitamin B12 is essential for nerve health, oxygen delivery to the brain, and proper neurological function. Unfortunately, the ability to absorb B12 depends on stomach acid and a compound called intrinsic factor, both of which decline with age. This means that even people who eat meat, eggs, and dairy can become deficient. B12 related headaches tend to feel dull, heavy, and mentally draining rather than sharp or throbbing. They're often accompanied by brain fog, poor concentration, dizziness, fatigue, or a sense that thinking requires more effort than it should. Many seniors live with these symptoms for years, assuming they're normal, when in reality, the brain is struggling to function without enough B12. Left unaddressed, deficiency can worsen nerve sensitivity and make headaches more frequent and persistent. Vitamin D is another silent player in senior headaches, particularly when inflammation is involved. Vitamin D helps regulate immune responses, reduce inflammation, support nerve signaling, and protect blood vessel health. After 60, vitamin D levels commonly fall due to reduced sun exposure decreased skin synthesis, and lower kidney activation. Low vitamin D doesn't just affect bones, it alters how the brain perceives pain. Seniors with low vitamin D often experience headaches alongside muscle aches, joint stiffness, low mood, and increased sensitivity to pain overall. Headaches may worsen during winter months or periods of limited outdoor activity. What's important to understand is that vitamin D deficiency doesn't usually cause sudden headaches. It lowers the threshold at which pain occurs, making the brain more reactive to stress, poor sleep, or other deficiencies. For seniors taking cholesterol lowering medications, particularly statins, another nutrient becomes critically important: coenzyme Q10. CoQ10 is essential for cellular energy production, especially in organs with high energy demands like the brain. Statins reduce the body's natural production of CoQ10, which can lead to fatigue, muscle weakness, and headaches that feel closely tied to exhaustion. Seniors with low CoQ10 often report that their migraines worsen when they're physically or mentally tired, and that rest doesn't fully restore their energy. While CoQ10 is present in small amounts in foods like fish, nuts, and seeds, supplementation is sometimes necessary, but should always be discussed with a healthcare provider to ensure safety and proper dosing. Iron deficiency, though less discussed in relation to headaches, can also play a role, especially when oxygen delivery to the brain is compromised. Low iron reduces hemoglobin levels, meaning less oxygen reaches brain tissue. This can cause throbbing headaches, dizziness, weakness, and shortness of breath. Seniors with digestive issues, a history of blood loss, or reduced dietary intake are particularly at risk. What makes iron-related headaches tricky is that they often worsen with activity or standing and may be dismissed as just fatigue. In reality, the brain is responding to low oxygen availability, and the headache is a protective signal. Hydration deserves special attention as well. As we age, thirst signals become less reliable, and many seniors unintentionally drink far less water than their bodies need. Mild dehydration can be enough to trigger headaches because the brain itself slightly shrinks when fluid levels drop, pulling on pain-sensitive structures inside the skull. Medications that increase urination further compound the problem. These headaches often appear in the afternoon, worsen with concentration, and improve temporarily after drinking fluids. Yet, many people don't connect the dots. Hydration alone may not solve chronic headaches, but inadequate hydration can amplify the effects of every other deficiency we've discussed. What's important to understand is that these deficiencies rarely occur in isolation. A senior with low magnesium may also have low vitamin D. Someone with B12 deficiency may also be dehydrated or low in iron. The combined effect places stress on the nervous system, reduces resilience, and lowers the brain's ability to regulate pain. This is why headaches after 60 often feel more stubborn and less responsive to over-the-counter pain relievers. The issue isn't just pain, it's imbalance. Headaches are not punishments, they are messages. When the brain lacks the nutrients it needs to regulate blood flow, calm nerves, and manage inflammation, pain becomes its language. Masking that pain without addressing the underlying cause may offer temporary relief, but it doesn't restore balance. True improvement begins with understanding why the headache exists in the first place. If you're experiencing headaches after 60, start by asking better questions. Have your nutrient levels ever been tested? Have your medications been reviewed for nutrient depletion? Are your headaches accompanied by fatigue, muscle tension, brain fog, or sleep disruption? These clues matter. They tell a story, and when you listen carefully, that story often points to a correctable deficiency rather than an irreversible condition. I want to be very clear. Supplements are not magic, and more is not always better. What matters is precision, understanding what your body is missing and addressing it safely, preferably with the guidance of a qualified healthcare professional. Sometimes dietary changes are enough, sometimes targeted supplementation is appropriate, and sometimes correcting one deficiency improves absorption of others, creating a cascade of improvement that reduces headaches naturally over time. If this video has helped you see your headaches differently, I encourage you to like it so more seniors can find this information. Subscribe to the channel for weekly guidance on aging well, and leave a comment sharing which deficiency surprised you the most. In an upcoming video, I'll be talking about common foods that silently trigger migraines after 60, and the substitutions that can make a meaningful difference. Your body is not failing you, it's communicating. And when you learn to understand that language, you give yourself the opportunity to feel better, think clearer, and live with less pain. I'm Dr. Nereta. Thank you for spending this time with me, and I'll see you in the next one.